Once someone has undergone a spinal surgery, oftentimes surgeons order spinal precautions to be followed by the patient. These precautions help to maintain the integrity of the joints for healing purposes. These precautions are generally in place around 6 to 8 weeks, however may last longer depending on the surgeon. Precautions must be followed until you are cleared by your surgeon. Let's discuss the different spinal precautions. To review, an easy way to remember spinal precautions is the acronym BLT. When someone has undergone spinal surgery, they want to avoid bending or rounding of the back, no lifting more than 8 to 10 pounds, and no twisting of the back. Following a spinal surgery, individuals may try to bend and twist when putting on clothes. Here are some ways on how individuals can dress their lower body following a spinal surgery. Let's start with putting on pants. When putting on pants, it's important to remember not to bend or round the back or twist the back to try to put on pants. Due to new precautions, many individuals utilize adaptive equipment for their new dressing routine. Let's demonstrate how to use proper adaptive equipment for lower body dressing. To begin, the individual will bunch up the fabric until there is a clear hole from the waistline of the pants to the bottom of the pant leg. Using the reacher, the individual will clasp the reacher claws around the bunched fabric. From there, the individual will place the end of the reacher with the bunched fabric right next to the leg. Next, the individual will slide their leg into the hole. Using the reacher, the individual will bring the pants up until it is over the knee. Next, follow the same steps with the other leg. Once the pant waistline is over both knees, have the patient stand using proper body mechanics to pull the waistline of the pants over their hips. Now, let's discuss how we will put on socks following a spinal surgery. Like pants, many individuals will try to bend or twist their back in order to put on socks. To prevent this, individuals may utilize adaptive equipment. The individual will utilize a reacher and a sock aid for this task. Here is a quick view of the sock aid. The individual will slide their sock onto the sock aid on the side with no ropes attached. This will create an opening for the individual to slide their foot into. The individual will grab both ropes and drop the sock aid on the ground with the sock opening by the foot. The individual will use the ropes to slide the sock over the foot, choking up on the ropes as they are pulling the sock over it. Once the sock is on the foot, the individual can use the reacher to readjust the sock as needed. To take off the sock, the individual can use the reacher to grab onto the outside of the sock and push down to pull the sock off of the foot. Finally, let's discuss how to put on shoes. For this task, we also recommend using adaptive equipment or receiving help from a friend or family member. To begin, the individual will place the shoe below their leg. The individual will slide the top half of their foot into the shoe, From there, the individual should place the long-handled shoehorn along the back of the shoe to help provide support for the heel when sliding into the shoe. Depending on the type of shoe you have, you may need assistance from a family member or friend to tie shoelaces or help slide the shoes onto the foot.